We have 242 patients hospitalized and 81 in the ICU units, and we have no red counties in West Virginia. Good stuff. Good stuff. Now here's something to be concerned about. The median age, meaning the average age of the new cases in the state of West Virginia. Now think about this. It came down to 44 years of age. And we thought, uh-oh, we need to get our young people vaccinated. We came down to 44 and we thought, we got a problem. We need to get to our young people, we need to get them vaccinated. Now, the average median age of people that are being tested in the state of West Virginia that are testing positive, 34 years old. I'm telling you, I'm telling our young people out there, I'm telling you as point blank as I can tell you, that you absolutely should have a valid concern to be able to go get vaccinated. Without any question, there's every medical expert in the land can tell you that your exposure to causing a real issue, even if you don't get sick, you can transmit this to others that may be your granddad or your mom or whomever, and we lose them. That's one thing. But the second thing is there are side effects from this. And if you were positive today and you didn't even get sick, you may end up with a significant side effect throughout the rest of your life that would absolutely be bad. So we have got to get you vaccinated. That's why we came out with the savings bond. From the standpoint of doing something that was old-timey maybe, but with that, doing something that had a patriotic flavor that we all need. We all need another dose. We all need another dose of patriotism. So we'll get to that in just a few minutes. But remember, the average age today in West Virginia on the people that are being tested, 34 years of age. Those are the ones that are positive today. That means we've got a ton of young people from 16 to 25 that are testing positive. We've absolutely got to get those people vaccinated. Now, a reminder again to those that are 65 and older and everything, if you get any symptom at all, go get a test. Go get a test where we can give you the antibodies. They are miracle workers. Now, I've got some announcements. As part of this ongoing effort to get more vaccines in West Virginians' arms, today I'm announcing that between now and Memorial Day, we're going to hold free vaccination clinics at all West Virginia state parks. Before Memorial Day, we're going to start with the high traffic community parks and we'll add more as needed. The parks we're going to target before Memorial Day are Chief Logan, Pipestem, Little Beaver, Cedar Creek, Cooper's Rock, Kanawha State Park, Greenbrier State Park, Tigert Lake, Berkeley Springs, and I'm going to really mess this up, but I believe it's Tuindi-Wee. Is that close? We'll go with that, okay? Now, and on the Memorial Day weekend, all West Virginia state parks and forests will offer vaccines to employees, families, and park guests. Clinics will be set up at Central Park locations, and they'll all be outdoors, and all the details will be posted on our West Virginia stateparks.com. All those that are eligible for the vaccine are anyone 16 years of age and older. I am again calling on our young people and their parents and their grandparents. Help us. You helped us so much in the census and everything all throughout this whole thing. Help us. We need to get these young people vaccinated. Not only could it save their life or an elderly person's life, but it could save them from all the potential side effects that come along the way, And the other thing we're doing is we're trying to get every single one of them a U.S. savings bond, a $100 savings bond. It's something that they can keep or they can turn in or whatever it may be. But nevertheless, it's something that I think it really ties back to how we've gotten through all this. We've gotten through all this being great West Virginians and great Americans, and it gives us that flavor. So please help me there. And the vaccine update, we've got 83% of our people, the 83% administration, for this week. And with first and second doses in West Virginia, we continue to do real well there. Our goal is always 100%. We can't get to 100% unless we have the arms available to get them in people's arms. Over 2/3 of our West Virginia residents age 65 and above are fully vaccinated now, and really that number is 69.2%. Over 1/3 of our population, really that number is 42.2%. 42.2% of West Virginians, our total population, have been fully vaccinated, both shots. And we're right at 53% of our eligible West Virginians who have had the first shot. I love this, and this is really great. From Saving Our Wisdom, these are the 65 and older people that we started vaccinating and led the nation on. No telling how many lives we saved, and I give so much credit to all my medical team, all the people that are out there on the ground in health departments and whomever it may be. But you just think how many lives you saved. How many lives you saved, and it is unbelievable. We're at 78.8% of the people that are 65 years of age and older, that are now vaccinated or have now received their first shot, and I'm sure they'll follow up and get their second shot. And it's just really good stuff. Good stuff. I want to touch on it one more time. If you're 16 to 35 years of age and you have gotten your vaccine, you will receive a savings bond of $100. I hope and pray that you'll at least either keep it or take a great picture of it and everything, and be able to know that it is you have really stepped up and you have helped us stop this dreaded killer. You have done something really special. You have heard the call of our nation, of West Virginia, and absolutely you've stepped up. So again, I encourage everyone out there to help me. Help me really ring the bell as far as the number of folks we can get from 65 or 16 to 35 years of age. Now, do I really think this is the end-all, do-all? This is the end of the road, that we won't have to do anything else? Well, of course I don't think that. This is not a silver bullet, but it can absolutely be the tool that gets us across the finish line. So absolutely, come on, help me there, please. As far as the manufacturing and the churches and everything, where we can go to businesses and churches and be able to vaccinate congregations or employees, absolutely, we're begging you to call us and we'll set it up and we'll come. As far as our vaccine info line, as far as vaccine reminders and everything, they're all up. Please just look at it and everything from the standpoint of all of our testing and our free map, free testing map and everything. All of our testing is free. We always thank Walgreens and Frith for all that they've done. Now, here's something to be a little alarmed about. We have 17 outbreaks at our long-term care facilities now. Now, we got to watch. We really have to watch. We have 7 outbreaks in 6 counties at our churches. That's not as good as it was, and it's absolutely trending the wrong way. That's Jackson County, Hardy County, Berkeley County, Grant County, Greenbrier County, and Nicholas counties. Stay on top of this in our church community. We really, really need you to keep on doing the great work that you've done. At corrections, we're down to 39 inmate cases and 7 staff cases. We have 21 at Southern Regional and 10 at Eastern Regional. I remind you over and over about your face coverings and all that, and God knows I want rid of this as fast as we can possibly get rid of this mask. We're absolutely so close, so close. If we'll have a final push on vaccinations right now, we can use what I said all along, the bridge, the vaccination. We are bridging ourselves to the vaccination, but now we have the vaccinations. Now all we need to do is get them in people's arms and we can stop this thing. We can surely stop the mask. We can stop it. I remind you over and over about giving blood. You know, I think you've got an obligation to at least consider that if you had the blessing of God above to recover from this dreaded disease, you ought to at least consider, moving forward, and we'll surely be tremendously grateful. Now I want to say one last thing and everything, and I want to just go back to a situation that happened with me yesterday. Yesterday I was going through a Wendy's as I do from time to time, and I was just getting, I don't know what it was, maybe it was some chicken nuggets for baby dog, but nevertheless there was 3 kids, well, not kids, I mean they were 16 to 35 years of age, and they were working there. And they all had masks on, and one of the ladies said, when are we going to be able to get rid of these masks? And I said, to the young lady there, I said, you don't want to get rid of them any more than I do. And really and truly, I want them gone so bad, it's unbelievable, and we're close. And then I turned to them and I said, have y'all been vaccinated? And the lady that asked me about the mask had been fully vaccinated. She had both of her vaccinations. The 2 other people there, a boy and a girl, and neither one of them had been vaccinated. And I told them, I said, you really need to go do this. You really, really need to consider doing this. And they looked at me and they said, well, we're afraid. We're afraid. In fact, one of them said, there was one case of somebody, and I can't recall if she said in Virginia, or she didn't say it was in West Virginia at all, but some other state, that their skin started to erode. It was like their whole skin was on fire all over. Well, I'm telling you, we get scared by everything, do we not? And in most instances, people are just scaring each other from the standpoint of the dark in the closet. It's not true. And really and truly, most of the time when we get scared, then we do silly things or frivolous things. Our young people need to understand that there's no way Jim Justice would be here telling you this. There's no way in the world that Clay Marsh, our coronavirus czar, General Hoyer, Dr. Amjad, there's no way in the world that we would be sitting in front of you giving you statistics that are skewed one way or the other. We're not going to do that. I am telling you, to all of our young people, these vaccines are so incredibly effective and so incredibly safe, it's off the chart. Your risk of not taking a shot today is unbelievable compared to any risk involved with the vaccines. And believing all these crazy things like instantaneously your skin's going to be on fire and you're going to burn up in 10 seconds or you're going to grow antlers or whatever it may be that anybody scares you with, please don't listen to that stuff. If you absolutely step back from this and you just think about just one thing, do you want to really run a risk? The likelihood of life expectancy today, by the time that a 20-year-old would get into his or her latter years, you're probably going to have a real shot, maybe at living to be 100 years old. Well, just think about it. If you were 20 and you had a real shot to live to be 100, 80 years, would you want really to threaten that with the possibility of getting this dreaded disease, ending up in an ICU unit? Would you want to really threaten or that possibility of 80 years of wonderful life by having this disease and then having some level of side effect that cut that life short or gave you some terrible life going forward? Would you want to absolutely put exposure, your parents or loved ones or grandparents or whomever it may be, and your likelihood of picking this disease up if you don't get vaccinated is unbelievably high compared to those that are vaccinated. Don't listen to that garbage, please. Those folks, those kids, and that's all they are, is just kids. Kids on their way. Kids that are out working. Kids that aren't just in trouble somewhere and everything. These kids are working, and these kids are trying to get on their way, but they're afraid. And I need all of your help to absolutely lay aside that fear and help me help them to understand that this is what they should do. This absolutely will protect them and all the others around them. So with that, and I really don't have anything else, and let's go forward with the questions and keep on going.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning, and I'll be very short. The governor has really said what I think is the most important messages for our residents. And that is, as we look at West Virginia, we should be very proud, but we also should be very thoughtful about what we can do as a community, as a state, to help make sure that we are protecting ourselves and each other. We do know, as the governor said, that the average age of somebody infected with COVID-19 has really reduced over the past several months. And we know that our 10 to 19-year-old age category is our largest for the positivity rates and spread of COVID-19. We know that the United Kingdom variant continues to grow and is our most common form of COVID-19, which is about 50% more infectious and up to 50% more lethal. We also know that around the world and even in our country, that this disease has really changed from one that very much attacks and causes the demise, the death, the hospitalization, severe illness in elders, to one that really is affecting younger people. In India, they're seeing many, many younger people infected, and they also have a problem with the United Kingdom COVID-19 variant, and also another variant that happened in India. So as the governor said, because of the great effectiveness of the vaccines and the incredible safety profile of the vaccine, safe for young people, safe for people who are trying to conceive, safe for pregnant women. We've seen the risk of COVID-19 in pregnancy cause a really substantial increase in risk to mom for having hospitalization and even death, and risk to baby for being born prematurely, that are taken care of by the vaccines. And so we really do hope that all of our young West Virginians will take this into account and choose to be vaccinated. And also that gives us an opportunity to slow down the spread of the variants and give us more time to vaccinate the rest of our population as well. So if we look at much of the rest of the world that don't have access to vaccines, they very badly want more access. And we have the great privilege of having plenty of access to vaccines. And we want to make it even easier, as the governor has said, and even incentivize people to consider choosing to be vaccinated, because we do feel like not only is this patriotism to our country to slow down the spread of this virus in our country, but also patriotism to our families and our communities. So thank you.
All right, thank you, Dr. Marsh. Next, we'll go to Dr. Ayn Amjad, our state health officer.
Good morning. We are pleased to announce that we were able to have a contract for our electronic death reporting system. The name of the company is VitalCheck Inc. It is a LexSmart Nexus company. We were able to sign that yesterday. So that will implement an electronic death reporting system in the state of West Virginia. So we will be able to have electronic death certificate reporting system throughout the state. So that was good news that we were able to implement that and get that started. So, but in addition to that, I just wanted to note that we are having a lot of misinformation about the vaccine, as the governor alluded. So we do want to make sure that people are getting proper information. The CDC does have information about the vaccines also on our website. But that's all I had, Jordan. Thanks.
Thanks, Dr. Amjad. Next, we'll go to Secretary Bill Crouch with the DHHR.
Good morning, everyone. You'll notice some changes to the dashboard this morning. The governor talks about these numbers every press briefing. We've decided to put this information on the front tab, first page, the overview of the dashboard. This data differs from the DHHR data, which we will continue to provide on the vaccine summary. The difference in this data is that it includes immunization data for VA, the VA population in West Virginia. It includes federal employees. We have some FBI employees up in the central part of the state. It includes federal prisons, which are outside of the doses that we get in West Virginia. It includes also West Virginia residents who may have gotten their vaccination out of state, whether they have a second home somewhere and they received those vaccinations there, or went across the border to a pharmacy from a border county. Those data are not available to us directly, but we do get those from the federal government. You'll also notice one other change. There's a little yellow tab with variant data. We're now providing information on variants as requested by county. Those variants circulate throughout the state. We have a total of 880 cases right now affecting 47 counties. We have broken that down by race, and we've broken that down by sex. So that information is available on the yellow tab. As new variants come along, we will add those as well. Thank you.
To me, just a second. Okay, just a couple of things I want to do and everything before we get into our questions and everything. Are you to me? Okay. One is Dr. Amjad, came up with a chart or a graph and everything, and it shows our COVID cases, hospitalizations, and deaths among West Virginia residents from August the 2nd of 2020 until April 17th of 2021. And if you'll look at it and everything, the blue line shows the number of deaths by week. The red line, the number of cases per 100,000. And the green line are hospitalizations. And so if you'll just look at this and everything, how this all flows, it'll give you a better understanding of what we've done, where we started, where we moved to, and everything. If you look all the way back into 2020, and you look back to an August date in 2020, you'll see the deaths. We had not started really ramping way up in our deaths and everything, but the number of hospitalized, the green line was off the chart. And then by the time we got out really into an October time frame, the amount of our hospitalizations started to decrease, but our deaths were really starting to ramp up. And so from really the October time frame until probably up toward the end of February, that's when our death rates went right straight through the roof. And so if you'll look at where we are today, our death rates are really at at or equivalent to really before we even hardly got started. So it's a great chart. Dr. Amjad did a great job putting that together. And I only have one other thing, and this is good, but it's tough. We have an employee that's worked for our DOH, Kermit Ray Kirkpatrick. And Kermit has been a wonderful, wonderful employee. And for his entire career, he's worked with the DOH. And he had to retire just recently due to an illness. And he is unfortunately really, really fighting that illness. So today, I've got a certificate that is absolutely our certificate of appreciation to a job that was well done beyond belief that I want to do for Kermit right now. And I hope he's watching and everything, but I'm going to sign this and then, I'll read the big stuff on it as best I can because I can't see the other stuff very well, but Kermit, here we go. And what this says is, the state of West Virginia, Jim Justice Governor, greetings, be it known that Kermit Ray Kirkpatrick is hereby awarded this certificate of appreciation for 20 years of dedicated and outstanding service to the state of West Virginia, Division of Highways, and the citizens of the great state of West Virginia. And then the print gets really small, so I'm not going to be able to read that, but it's by my hand, Governor James C. Justice II. So Kermit, we love you. We're going to be with you always, and we keep you in our prayers, and thank you for all you did for each and every one of us for all those years of wonderful service. And we're going to pray for your long and healthy life and everything in every way. We're going to continue to pray that everything works out and works out good.
All right, thank you, Governor. Retired Major General Jim Hoyer, director of our Joint Interagency Task Force, had a prior commitment today, but he will rejoin us on Monday. We'll now go to questions from members of the media. The first today from Mark Curtis with Nexstar Media.
Good afternoon or good morning, Governor and everyone else. I want to follow up on a question I had the other day because it occurs to me that getting successful at vaccinating 16 to 35-year-olds, you can't wait for them to come to your clinics. You really have to take the clinics to them. With that in mind, whoever came up with the idea of having the clinic, the state basketball tournaments at the Coliseum was brilliant because you have the captive audience there. And so I'm wondering if you're efforting more high school clinics at the high schools before school's out. I believe school's going to be out in 3-4 weeks. And all of a sudden, the opportunity to get a large number of those students in one place and vaccinate them goes away for the entire summer. So I'm wondering what your game plan is with that regard. Maybe General Hoyer can weigh in on it, or the governor, or anybody who has an opinion on it.
Well, Mark, you're dead right. You're 100% right, and I think General Hoyer may have the best answer. But if not, well, he's not here today, so Dr. Amjad can answer. But let me just say just this: we are all over taking the vaccines to these young people and to all of our folks. But we absolutely will be announcing further details on Monday of a complete rollout of all the different things that we're going to be doing as far as, all across our state and everything, to be able to take the vaccines right to our kids and everything. I love what they did at the state tournament. We set up at the blue and gold game up in West Virginia, at West Virginia University. Absolutely, we have got to take these vaccines right to our kids because depending and waiting on the kids to come to a clinic and everything, that'll get, some response, but we've got to recruit a whole lot of help, and that's help from our school superintendents, and our school principals and all the Department of Ed, and we're working that, Mark, in every way. And I don't know what else Dr. Amjad could add. Maybe she would choose to add something that I've missed, but But the net of the whole thing is we rolled this out really fast, and now we're putting together all the details and the practicality of getting to the schools and getting to everybody absolutely before school's out.
Governor, the only thing I'll add to what you're saying, but Mark absolutely will take it to where any place students are, to the schools, to any outside venues, soccer fields, sporting fields, anything where kids are gathering to play sports. But as the governor mentioned, we'll take it to anywhere schools or children are playing or gathering. So if there's anyone out there that has large events where kids are going to be before the school is out, we'll absolutely bring it to them. We are anxious to get kids vaccinated before school's out throughout the summer events, but we'll bring it to them for sure. Thanks.
All right, thank you, Mark. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. Governor, I wanted to ask a quick question about vaccination since we've pushed so very hard to get that done. Where is the reward for young people getting vaccinated is clear? It's $100 savings bond, or it's $100 in cash, whichever way you work it out. Where's the carrot for people who've gotten the vaccine, other than you're healthier, probably not going to get a serious illness, and you're probably not going to die? You keep saying we're really close to getting rid of masks. Is there any way you can slice that down to be more specific to, especially to people who've gotten the vaccine, maybe not for the entire population, but definitely for people who've gotten the vaccine, to use that as a possible carrot, as a possible incentive to get more people overall to take the vaccine? Because it feels like there's a temperature of people that are talking with me that slowly but slowly, you're starting to lose people on the edges about this mask thing. And my thinking is that if that continues and if it snowballs, you're just going to lose the room where masks are concerned, maybe for everyone, before that should happen. Thank you.
Okay, Kenny, a lot of aspects of what you've asked. It's good stuff. Just think of the psyche, the way I see it. Young people think they're invincible. From the standpoint of, I felt like you needed an additional incentive to get them to take the vaccine because they think they're invincible. From the standpoint of our elderly, well, I mean, we have had a response there that was phenomenal because those folks know that they are really, really exposed. And so their reward has to be saving their life, saving the lives of others, saving their neighbor's life, all the different aspects that go with that. Now, as far as how we move forward with this, there's got to be, as far as the mask, I want rid of them. I don't know whether the sweet spot is at 63%. We can start removing the mask. Kenny, you make a really good point to say, if you're fully vaccinated, you absolutely, under a new executive order, can remove your mask. And maybe that is a stepping stone as we go forward, but with so it's a little it's not a little difficult, it's massively difficult, and you need absolutely always, and this is what I will do always, is I will let our experts guide us to the point that my gut then says, hold on, everybody, full stop, full stop, full stop. We're going the wrong way, and I'm going to go this way. But if we just go right back and let's just think about the mask, if our experts, first of all, the CDC is saying, you don't need to mask outdoors. From the standpoint of, and we've never had a mandate on mask outdoors. We have. From the standpoint of where you are, if you're fully vaccinated and everything, and we can get rid of these masks, that's one thing. But see, I'm wanting to get rid of the mask, period. And I truly believe just this, that right now we're at 53% of our total population that's had the first shot. Well, they'll get the second shot. All I'm interested in is how many of them have gotten the first shot. 53% of our people have gotten the first shot. If we can get this level to a 65 or 63 or whatever it may be, at that point in time, our medical team and medical experts may very well say, Governor, I think we're good enough to go without our masks now. In the meantime, Kenny, your idea of possibly, going with the people that are fully vaccinated and using that as a motivational tool to get more and more and more people vaccinated, it's a good thought. It's a really good thought, and we'll surely consider.
All right, thank you, Kenny. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. My question's for Dr. Amjad. Could you give us a little bit more detail about the contract for our electronic death reporting system? How much should this cost? Is this an annual contract we're going to have to renew? Are we going to be able to to reimburse these funds from CARES Act money or federal dollars, or is this coming out of the DHHR budget? Thank you.
Dr. Amjad, please.
Yes, Charles. It's going to be a 5-year contract. It's with VitalCheck Network Inc. It's a LexisNexis company. We had several meetings with our internal MIS department, our OT department, and our National Guard. So we took a long time to vet, this particular company. As far as the funding goes, I'd have to defer to our legal team where the actual funds are coming from. But it's a very good company that we settled upon. We did have to review several of them, and we had to do it very quickly. But I'd have to get those exact details to you separately, Charles, because the legal team has to go through all that as far as where the money exactly is coming from. So I don't have those answers right now.
Just a second, because Charles, I want 1,000% transparency all the time, and if I know something, I want to be able to tell you. But the funds have to come through general revenue because it's going to cover all deaths across all sectors, of our population and everything. And what it's there to do is be able to facilitate in such a more efficient way than what we've done in the past and everything, because you've got people that have funeral expenses and all kinds of things, life insurance policies and all kinds of things. We just need to do a better job than what we've done in the past.
All right, thank you, Charles. Next, we'll go to Mark Cram with WDVM.
Good morning, Governor. Good morning to everyone. Well, we'll say phenomenal efforts to make the vaccine available to all who will take it. The convenience, the strong message that's been issued here, and now even monetary rewards. But I still hear a number of individuals say absolutely flatly they are not going to take the shot. There are some other states that have suggested they may look at a mandate where everyone's ordered to get it, like your childhood shots that you have to get before you go to school. Has this crossed your mind, Governor? And is it you're going to continue to look for creative ways that you've been successful with thus far?
Well, Mark, listen, I appreciate all you do up there in the Great Eastern Panhandle and everything all the time. And Mark, I do not believe, that we really can just come out and mandate without a federal response. And from the standpoint of how I feel, I don't think we should do that. And but Mark, it is terribly frustrating, and if the people that are just for whatever the reason saying no, I'm not doing that, and because they run such a risk, it's unbelievable, and they expose so many others, and I just don't agree with it. We're in a real emergency situation, and we've been in it for a long time. I mean, for crying out loud, if I would have come in today on a day that we had 6 deaths and said, that's great, we've got 6 deaths, but if I would have had to have read, these 6 names and said we had a plane crash, a small plane that went down and these 6 people died, or we had a mine disaster and it was really bad and these 6 people died, or we had a bus that went off a bridge and everything, and thank God there wasn't a whole lot more people on the bus and 6 people died. It would have been tragic beyond belief, and this is the best day that I have been able to report to you in many, 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 many weeks, if not months. You know, this is the best day. And literally, if I would have had to have come in and done one of those 3 options that I just described, it would have been absolutely, everybody would have been sitting around and been sad, you know, and so for us to just turn our nose up and say, well, we're not going to take the vaccine, and we're having this continue and continue and continue, and we don't realize the emergency that we're in, and if we would just take the vaccines, for crying out loud, we could stop it. It's frustrating, it's disappointing. I don't think we need to mandate anything like that on people, but you know, and I don't think I can, you know, but we really, I guess the only thing I can do is just continue to do what I have been doing over and over and over, is try to find creative ways to get more people across the finish line, because if we can get enough across the finish line, we'll stop this thing.
All right, thank you, Mark. Next, we'll go to June Leffler with West Virginia Public Broadcasting.
Hello, Governor and panel. My question is directed to either our health officers or Secretary Crouch. So we've been talking a lot about how the median age of those that are getting the virus has lowered. Can you tell us more about hospitalizations and deaths as it relates to younger folks? And also, I'm curious about breakthrough cases. So the last I heard from DHHR, there were 129 breakthrough cases in the state, but DHHR wasn't able to provide if any of those people were hospitalized or died. Can we get more information on that?
Dr. Marsh, why don't you start, and we'll bring in Dr. Amjad and Secretary Crouch too.
Thank you, Governor, and thank you, June. So, from the standpoint of the more cases in younger people, we believe that is related to the new viral variants that are now the most common form of COVID-19 in West Virginia, which is the United Kingdom variant, and also the most common form of COVID-19 in the United States. And as we said, the 10 to 19-year-old group has the most spread, and the 20 to 29-year-old group has the most spread of the United Kingdom variant virus. When we look at hospitalizations, we have stayed relatively steady for the last week or so at a reasonably low number of hospitalizations, around 223 West Virginians in hospitals from COVID-19, which, as the governor said, is a lot, but relative to the peak that we saw several months ago in January and December, that is substantially reduced. We have seen the trend towards some younger age groups in the hospital, 40s and 50-year-olds, but we haven't seen that go all the way down to really young people. And I think it's important to recognize that when we look at our deaths, and we are looking at the deaths of younger people, the governor, not this press brief, but the last press brief, had several young people included in the deaths that he recited at the beginning of our press brief. But as we start to look, not only in West Virginia, but we look around this country, the good news is we are seeing the deaths from COVID-19 at some of the lowest levels that we've seen in a number of weeks. The cases have still not really dropped. And that may relatively, be because we're seeing more younger people get infected who are still less likely to die than our older West Virginians and older Americans and older world citizens. But the issue that the governor has talked about is so important, because this is the group that spreads to others, and we still have a number of vulnerable West Virginians not vaccinated at risk. And number two is we are very worried about the long-term ramifications of the virus in younger people. This so-called long COVID syndrome is really an important one, as we know that, for instance, in a group of people that were surveyed who had had COVID-19 as an outpatient, about a third of them at 6 months still had some thinking problems, brain functioning sort of issues that they complained of. And for people that were hospitalized, almost 50% of people still had abnormalities. So we know COVID can affect the heart, affect the brain, can cause blood clots, can cause strokes, heart attacks, etc. And this is not said to scare people, but it's really true that even though a lot of young people might say, well, my odds of dying from this are not as high, the concern is that they could certainly suffer consequences for their entire life, which would be just tragic. And number two is if they don't become immunized, then they also may be spreaders to other people who are vulnerable, who are in their families and in their communities. So, Governor, I'll turn it over to Ein for more comment.
Thanks, Clay. As far as the question you asked June about more breakthrough cases, with the vaccine data, our epidemiology team, it takes them at least 2-3 weeks to collect that data. It's hard to collect the data across the different information that we have to get breakthrough cases and to see if they've been in the hospitals and so on. They do have to collect data across different information systems. So we did, we check that information daily with Shannon McBee, who's our state epidemiologist, and she didn't have any additional information from the we had 129 breakthrough cases initially, and then we knew that about 3 people had passed away from that. So we don't have any more up-to-date information. Hopefully next week she'll have some more, but it takes her team a while to cross-reference all that kind of information. But the important thing to know is that we are seeing younger people in the hospitals, and we are seeing younger people, as the governor mentioned, as our median case, which is 34. So that's a takeaway message. We want people to know that younger people are in the hospitals, and younger people are testing positive with COVID-19, which is why we want people to get vaccinated as soon as possible. Thanks. I'm not sure if Bill has anything more to add. But.
Thank you, Ann. The only thing I'll add is the hospitalization data is, we get that from the West Virginia Hospital Association. They're great partners with us. We don't get a lot of that information by age. That's not available to us routinely. Our epidemiologist does look at that data and pull data from files. The idea of the breakthrough questions is a good one, and we may look at seeing if we can get that on the dashboard as well, June. So thank you for that question.
All right, thank you, June. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. Governor, I wanted to follow up on a question that Stephanie Rule asked you earlier this morning. Given the state's low rankings in education, healthcare, the economy, and infrastructure, why are we spending time enacting a transgender sports bill that apparently addresses an issue that does not exist in West Virginia?
Well, Phil, first of all, you ought to ask the legislature. I mean, really and truly, I signed hundreds of bills. And, the next thing you should ask is you ought to ask a coach and me that coaches girls, and absolutely, I do not think we need, as hard as we worked on Title IX, for girls to be able to participate and work their butts off and everything and be able to excel in sports and everything. Why in the world do we turn around and get people just, the very people that worked so hard to get Title IX, and now they're trying to basically go back and possibly disadvantage our girls. Now, I am all for equality and embracing and loving everyone. I am 100% behind that. But in being a coach, I know that I've coached boys and coached girls as well. And to say that a boy could participate in a girls' sport and everything, through all that may go on and may happen and everything, it seems that it disadvantages the girls. And so with that, I am supportive of the bill. I want everyone to know that, and I'm not running from my level of support, because I absolutely support the bill, period. That's all there is to it. But at the same time, we do a lot of work here, and we sign lots and lots and lots of different bills, and this was not something that I put as a priority, but I am supportive.
All right, thanks, Phil. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. I'm getting my information from Phil's Charleston Gazette-Mail concerning the overdose numbers from 2020 that show a significant increase from the highest it's ever been, and certainly the last couple of years when it has trended downward. Governor, I'd like your opinion, and also Secretary Crouch, as to whether you consider these increased deaths another, they're not COVID deaths, but they are certainly related to the pandemic. Are they pandemic-related deaths? Do you see it that way? And how do you get the state of West Virginia back on the track that you had it on prior to the pandemic taking effect a year ago? Thank you.
Whoa, Paul, a question that I could talk about for a long time, and we don't have the long time. From the standpoint of Jim's Dream or Jobs and Hope program and all the different things, this terrible killer that can cannibalize all of us, and it attacks each and every one of us, black, white, rich, poor, Democrat, Republican, union, non-union, all that kind of stuff. We all have been touched by the drug epidemic. We want to continue to address and continue to know. I say this over and over and over, but there are certain things that we have got to keep our eye on the ball. Trying to rip us apart, and say from a transgender standpoint or whatever it may be, focusing on the very things that are the very things that can rip us completely to pieces were COVID, or the drug situation, and over and over and over. How to put us on a pathway in West Virginia to total recovery, if not better? Well, Paul, have we not already done that? Have we not done that over and over and over and over? Now, West Virginia's economic numbers are phenomenal compared to where they could have been. How we've handled the CARES monies, how we're going to handle the additional monies that come into our state. It's really important. It's really important that we don't screw it up. It's really important that we don't get frivolous and everything and throw away an opportunity that could right-side West Virginia to not only getting us back on the path to recovery, but absolutely propelling us beyond even our wildest positive dreams. And so, Paul, we'll continue to do that. And I want to add one other thing, real quickly, of all the bills that have come to me thus far, and this goes back to Phil and the transgender bill, but of all the bills that have come to me so far, I've vetoed one bill. Now, there was one bill that I just didn't sign and let come into law, but I vetoed one bill, and it was on a technical reason. And so, and then they fixed the bill and they sent it back down to me, and I signed it. So with all that being said, we sign a lot of bills, we do a lot of work, but at the same time, while each and every bill is important, and I get it, whether it be a transgender bill or whatever, each and every bill is important. I get it. But at the same time, there are other things that rise to a level of importance that we have got to absolutely always keep our eye on the ball. Paul, one of your question is about this terrible drug epidemic that continues to take life after life in West Virginia, and we've got to absolutely keep our eye on that ball because, as I've said over and over, it can cannibalize us if we let it go. And absolutely, we need to always remember the importance level that we need to keep right on that.
All right, thank you, Paul. Governor, I'll turn it back to you.
Well, you know, I am happy, as happy, I guess, as you can be about 6 additional deaths. I congratulate Kermit Ray Kirkpatrick, you know, on all of the great work he's done. I ask for your prayers for all the 2,679 and the 6 today that we've lost in this great state. And I ask that you'll stay with them. But whether we like it or not, we've still got to move north, do we not? We've got to live with this dreaded thing today. In some way, somehow, the good Lord gave us the ability to smile and to laugh. And so I'm going to leave you on this Friday with the best wishes for the weekend. And I'm going to leave you with that ability to smile and to laugh. And I'm going to leave you with the picture of my little buddy here that they're bringing, little baby dog. Okay, baby Nate, come on. Turn around here. Turn and put your feet down here. And she's got for you today, as she made the prediction on the Super Bowl, she's got for you today her prediction on the Kentucky Derby. And you should pay real close attention because she thinks she's got it right on the money. But she's picking essential quality to win the Kentucky Derby. And she's also picking highly motivated to come in right with essential quality. Her long shot is Hot Rod Charlie. And so if by chance you would like to parlay all them together into some level of trifecta, if that's what it's called and everything, the baby dog is putting a stake in the sand, essential quality, highly motivated, and Hot Rod Charlie. That's her picks. And so I don't know what in the world you wrote there, but nevertheless, thank you so much. She's got her hat. She's ready to go. She's not going to go because she can't quite go to the Kentucky Derby right yet, but she's watching on TV. Remember, essential quality, highly motivated, and Hot Rod Charlie. All right, thank y'all. She waves bye to you. All right.